Now, as soon as you reflect the skin from the lateral surface of the head, you will encounter the platysma. And the platysma is the cutaneous muscle of the neck and the head, very similar to the cutaneous tronchi that we have seen at the level of the trunk, which is the thorax and the abdomen. The platysma is this thin muscle with these thin fibers. This is the cutaneous muscle of the head and the neck. As soon as you reflect the platysma, you will encounter the superficial muscles. And the superficial muscles, we call them the mimetic muscles, okay? And also you will see some of the masticatory muscle, which is the muscles of mastication, okay? So when you reflect the platysma, this is the mandibular salivary gland, and we already opened the capsule that encloses the mandibular salivary gland, and that exposes the monostomatic sublingual salivary gland that is enclosed with the mandibular salivary gland in the same capsule. So this is here is the mandibular salivary gland. This part here, this is the monostomatic sublingual salivary gland. This is here is the masseter muscle. This one here is the digastricus muscle that attached to the ventral surface of the mandible. This muscle opens the jaw, okay, while the masseter and the temporalis and deeper the trigoideus, all those three close the jaw. The digastricus is innervated by two nerves. It's innervated by the facial nerve and also the mandibular nerve. The caudal part of the digastricus is innervated by the facial nerve, while the rostral part is innervated by the mandibular nerve. Continuing with the superficial structures, okay, at the surface of the masseter, we will see the dorsal buccal branch of the facial and the ventral buccal branch of the facial. In the middle of the masseter and in between these two branches, we will see the duct of the parotid salivary gland that runs and open against the upper fourth premolar. Now, also another branch from the facial we're going to see is the auriculopalpebral, and the auriculopalpebral will divide into two branches, an auricular branch that go to the ear and a palpebral branch that go and innervate the orbicularis oculi muscle, which is this muscle here. This is the muscle of the eyelid. This is the muscle that opens and closes the eye fissure. Okay. This is the lateral canthus of the eye fissure. This is the medial canthus. Okay. And the auriculopalpebral nerve, after it gives the auricular branch, you can block the palpebral branch at the dorsal aspect of the zygomatic arch. You can block it at that level here, okay, to give you a chance to examine the eye, because that will prevent the animal from shutting their eyes. We call that blepharospasm. So when you come to examine the eye, you need to block the palpebral branch of the auriculo. Palpebral is being cut here, but this is a continuation of it. This is the palpebral branch, and when you come to block it, you have to block it at this level here. This is the tip of the zygomatic arch. And the dorsal and the ventral buccal branches of the facial, they go and innervate the Pukinator muscle, which is this muscle here. And the Pukinator muscle is the muscle that pushes the food from the vestibule to the oral cavity proper for the food to be masticated and to be swallowed. Continue with the superficial structures besides the masseter muscle, besides the digastricus muscle, besides the Pukinator muscle. There is the muscle of the lip, okay, that is sitting under the skin of the lips here, and that is the orbicularis oris, okay, it is sitting under the skin of the lips here. Then we have the Pukinator, then we have the masseter, we have the digastricus over here. Also, here we can see part of the caninus muscle, and we can see the levator nasolabialis muscle. If we reflect the skin, okay, from the eyelids here, we're going to be able to see the orbicularis oculi muscle. Regarding the nerves, okay, this is the mandible, okay, this is the area for the mental framing. This nerve you see here, this is the mental nerve that is coming out of the mental framing to provide sensation to the lower lip, and we said this nerve, you can block it at this level here where it is coming out of the mental framing. Okay, from the infraorbital framing at this level here, what comes out here, this is the infraorbital nerve, which is a branch of the maxillary, and it provides sensation to the skin on the lateral aspect of the nose, and also it go to the upper lip. So this is the infraorbital nerve, and this one here is the mental nerve. Now, an area of confusion a little bit is the area of the facial nerve, and the area of the facial nerve, it has also another branch of the mandibular, that is the auriculotemporal, that is a sensory nerve to the face. So let us go through this one more time. This is here is the facial, this is the trunk of the facial nerve, okay. This is the trunk of the facial nerve, okay. It comes and it gives the dorsal and the ventral buccal, okay, and also it gives the auriculopalpebral that divide into an auricular branch, which is this one here, that go to the ear, and a palpebral branch that will go and continue, and a palpebral branch that go and continue to the orbicularis oculi. This is the rest of it here, okay. It is being cut from there. So this is the palpebral branch, and we said this one, you block it at the tip of the zygomatic arch, which means around this area here, around this level here, you can block the palpebral branch to prevent blepharospasm, so you can examine the eye. Now, I want to draw your attention to the auriculotemporal nerve that comes out in a close proximity to the facial, okay. This nerve here, this is the auriculotemporal nerve, which is coming from the mandibular, okay, and it will give these branches, okay, they run in close proximity, okay, to the dorsal buccal, but this is from the facial, and this is the auriculotemporal coming from the mandibular. The mandibular is coming in close proximity to the to the facial if you look at the origin of the mandibular here. But this one here, this is the auriculotemporal. It is sensory. Don't confuse it with the buccal, with the dorsal buccal, which is coming from the facial. This one is motor, okay, to the Pukinator muscle. The auriculotemporal is a branch of the mandibular, and it is sensory to the face. Just bear that in mind. Be very patient when you come to dissect in this area here, okay, and separate the facial from the mandibular, separates the branches of the facial, which is ventral and dorsal buccal and auriculopalpebral, okay, and try to find the mandibular and try to find the auriculotemporal branch of the mandibular, and this is sensory to the face, okay. Now, when you cut the head into two halves, okay, this is what you're gonna see. Now, starting with the nasal cavity, this cut is at the level of the nasal septum. You can see part of the nasal septum here, and you can see part of the nasal septum here. This will reveal the different nasal concha, which is the bony scrolls that extend inside the nasal cavity and covered by mucous membrane, and to form this nasal conchae. This nasal conchae humidify the air and also it attracts the particles, so it cleans the air and it humidifies the air that entering to the respiratory system. So once you cut the septum, you can see the concha, okay? For your orientation, this is here is the hard palate, okay? You can see the transverse ridges of the hard palate that fits as well as you are going caudally, okay? This is here is the soft palate. The space you see here, this is the nasopharynx, and the opening of the nasal cavity to the nasopharynx at the caudal end here, this is the choana where I am inserting the probe. Okay, the choana is this opening here between, up here, between the nasal cavity and the nasopharynx. Okay, I'm gonna put the probe through the choana, so you can see on this side here. So this is the caudal end of the nasal cavity. The probe now is passing through the choana to go inside the nasopharynx. So we have nasal cavity filled with the choana, filled with the conchae, the choana that leads to the nasopharynx. The nasopharynx is just dorsal to the soft palate. Here we have the tongue, okay? We can go through the muscles of the tongue once we are here. This thin muscle here that's sitting between the two mandible, okay? This one here, this thin muscle that is sitting between the two mandibles, this is the mylohyoideus muscle. This is the mylohyoideus muscle, okay? This muscle here that extends all the way to the basihyoid bone. This is the basihyoid, okay? This is the basihyoid, okay? And this muscle here, this is the geniohyoideus, okay? And this muscle here, this is the genioglossus. So we have genioglossus, we have geniohyoideus, and we have mylohyoideus. The mylohyoideus is this thin one here, okay? It is covering the ventral aspect of the geniohyoideus, and this one here is the genioglossus. Now, This area here is the nasopharynx. Now, this is here is the larynx. This area here, this is the laryngopharynx. And this area here, okay, this area here is the oropharynx. So we have oropharynx, laryngopharynx, and nasopharynx. Now, let us look at the conchae in another specimen. Okay. The most caudal conchae here, this is the ethmoidal labyrinth or the ethmoidal concha. Okay, this one here on the dorsal aspect, this is the dorsal concha, and this one here is the ventral concha. So we have a ventral concha, we have a dorsal concha, and we have ethmoidal concha. Now, these conchae leave passages, pathways. The most ventral one here, okay, this is the ventral meatus, okay, and the ventral meatus will lead to the nasopharynx. Now here, between the dorsal concha and the ventral, this is the medial meatus, and the medial meatus will take you to the ethmoidal concha, and dorsally here, the passage here, that is the dorsal nasal meatus, which is this one here, okay, and this one will lead to the frontal sinuses that you see over here, okay. Let us see this again in another specimen so it will be clear, okay. So we have here the nasal septum is being removed. This is here is the ethmoidal concha. This is here is the ventral concha, and this one here is the dorsal concha. Okay, down here, this is the ventral nasal meatus. This is the middle meatus between the dorsal and the ventral conchae, and dorsally here, this is the dorsal nasal meatus. And this whole space between the conchae and the septum that is sitting here, that is the common meatus for all the meatuses, for the ventral and the middle and the dorsal one. And we said, okay, the ventral nasal meatus will take you through the choana to the nasopharynx. Okay. I hope this is clear right now. This bone here, okay, at between the nasal cavity and the skull, okay, this is the cribriform plate. It has too many small holes or foramina for the passage of the olfactory nerve to the olfactory bulb in the brain. All these ethmoidal concha is filled with the olfactory nerve cell bodies, and the fibers, the axons, will run through the cribriform plate to go to the olfactory bulb in the brain. Now, when we come to the area of the larynx, let me orient you first. This is the mylohyoideus muscle, and we said this is the thin muscle that sits between the two mandibles. It is this one here. Okay. This is the geniohyoideus. It's go and attach to the basihyoid bone. This is the basihyoid bone. Okay. This is the mylohyoideus. This is the geniohyoideus, and this is the genioglossus. This is here is the apex of the tongue, this is the body of the tongue, and this is the root of the tongue. This is the hard palate, this is the soft palate, this is here the larynx, this is here is the nasal pharynx that leads to the nasal cavity. Now, when we come to the larynx, this is here is the epiglottis, okay? And this is here is the laryngeal ventricle, okay? This is here is the vocal fold. This is the vocal fold. This is the vestibular fold, and this is the laryngeal ventricle. So you have the vocal fold over here, and here this is the vestibular fold. Now, when we open the larynx here again, this is the vocal fold. Okay? This fold here is the vestibular fold. So vestibular fold, more rostral, and the vocal fold is mucosal fold here. This is the more caudal towards the trachea. Okay, this is the epiglottis. This is the corniculate process of the arytenoid cartilage. This is the cuneiform process of the arytenoid cartilage. The area from the entrance of the larynx all the way from the epiglottis, from the tip of the epiglottis, all the way to the vocal fold. Right? This is the vestibule of the larynx. Okay? The space in between the vestibular fold and the vocal fold, where I'm putting the probe here, this is the laryngeal ventricle. Okay? The area between the arytenoid cartilage and the epiglottis, this is the aryepiglottic fold. Okay? This mucosal fold here between the epiglottis and the arytenoid cartilage. This is the aryepiglottic fold. Now, the area or the space between the vocal fold and the arytenoid cartilage, this area here, okay, this is the rima glottis, okay, or the glottic cleft. And the space from the vocal fold all the way to the trachea here, this is the infraglottis. And we said, when we say the term glottis, that include, okay, the vestibule and also include the rima glottis, which means all this space here is the glottis. Now, a very important couple of structure here we need to mention, okay? This is the cricoid cartilage, and this is the thyroid cartilage, okay? These ligaments between the two, this is the cricothyroideus ligament, this ligament here. This ligament, okay, when you go through it, it will give you access to the laryngeal ventricle. I'm gonna insert, okay, the scalpel through the cricoarytenoideus ligament, which is over here. Let me make a cut. Okay. And this gives you access to the laryngeal ventricle if you want to do any surgical procedure there. It is this ligament here between the cricoid cartilage. Okay. Better here. Between the cricoid, it is this ligament here. I hope you can see it better now. It is this ligament here, okay, between the cricoid cartilage and the thyroid cartilage. This is the cricothyroideus ligament. Once you go through this, it will give you access to the laryngeal ventricle. Now, this here is the laryngeal ventricle again. This is here is the cricoarytenoides dorsalis muscle on the dorsal aspect. Okay, it is cricoarytenoides. It's between the cricoid. It extends from the cricoid cartilage to the arytenoid cartilage to the cricoid cartilage. This is the cricoarytenoides dorsalis, and this muscle when it contracts, it will tense the vocal fold. This muscle is innervated by the recurrent laryngeal nerve. When it reaches close to the larynx, the name changed from the recurrent laryngeal to caudal laryngeal. It innervates all the muscles of the larynx with the exception of one muscle, that is the Thyrodius muscle, which is the muscle between the cricoid cartilage and the thyroid cartilage. This muscle here. Okay, this is the only muscle that innervated by the cranial laryngeal nerve. All the rest are innervated by the recurrent laryngeal, and we said paralysis of the cricoarytenoides dorsalis muscle, which is this muscle here on the dorsal aspect. Okay, and we said this muscle tends the vocal fold. When this muscle paralyzed for any injury that involves the recurrent laryngeal nerve, that will lead to laryngeal hemiplegia. Okay, now once we are here, let me mention a couple of structures here. This is the root of the tongue, and this is the soft palate. This mucosal fold here, this is the palatoglossal arch. Okay, and if you go a little bit caudal to the palatoglossal arch, you will see this semilunar fold, this one here. Okay, and this one is covering the tonsils. These are the tonsils. If I reflect the semilunar fold, which is this one here, okay, this will expose the tonsils in this area here. Okay, now other structures here we need to pay attention to. Okay, we mentioned before the styloglossus muscle, and we said it is the muscle that extends from the styloid bone of the hyoid apparatus, and it goes to the tongue, and it is this muscle here. Okay? This is the styloglossus muscle. Okay, it is this one here. It extends from the styloid cartilage of the hyoid bone, and it go to the root of the tongue. Now, once we are here, let me go through. This is the common carotid artery, and the common carotid artery, when it reaches here, it will divide into an external carotid artery and internal carotid artery. Okay, let me expose it here a little bit. That is the internal carotid artery. This one here. Okay, and the internal carotid artery will going to go to the brain. Okay, this is the external carotid artery. The common carotid artery is accompanied by the vagosympathetic trunk. Okay, now let us see a couple of structures that we have been talking about for a long period of time, but we never seen it, and these are the distal vagal ganglia and the cranial cervical ganglia. Now, the cranial cervical ganglia, this is the sympathetic ganglia. All the synapses for the sympathetic nerve that are going to the head, they have to synapse at the cranial cervical ganglia. From there, the sympathetic nerve will run with the different branches of the external carotid artery, while the distal vagal ganglia, it's a parasympathetic ganglia for the vagus nerve. So now let us reflect the common carotid artery, and let us look at the vagosympathetic trunk. Okay, the vagosympathetic trunk. I hope you can see this. Let me open it more, and let me move this out of the way. This nerve you see here, this is the Glossopharyngeal nerve. And the Glossopharyngeal nerve divides into two branches. One, we're going to go to the tongue, and the other one, we're going to go to the pharynx. This is the glossal branch, and this is the pharyngeal branch that go to the pharynx. So this is the Glossopharyngeal nerve, okay? The one that you see on the dorsal aspect there. Okay. That is the accessory. I hope I can hold it here. This is the accessory nerve, which is cranial nerve number 11. And this one will go dorsally because it will going to go to the back muscle. Now, if we follow this here, okay, this numb you see here, this is the cranial cervical ganglia that we are talking about. And this lump here, that is the distal vagal ganglia. So don't confuse these two. This is the distal vagal ganglia. This is the cranial cervical ganglia. This one is sympathetic, and this one is a parasympathetic. After this, the vagus nerve and the sympathetic trunk will come together to form the vagosympathetic trunk that run all the way to the thorax. Okay, I think that it's for this area here. Now, close to the carotid sheath, this large lymph center that run by the carotid sheath, this is the medial retropharyngeal lymph node. Okay, this big lymph center here, this is the medial retropharyngeal lymph node, and all the lymph nodes of the head drains to this medial retropharyngeal lymph node. Now, to continue with the external iliac artery, it will gonna give this big artery, which is the lingual artery. And the lingual artery, which is this one here, is always accompanied by this big nerve, which is the hypoglossal nerve. Okay, so this nerve here that runs with the lingual artery, this is the lingual artery, and this is the hypoglossal nerve, which is cranial nerve number 12, that go to the extrinsic muscle of the tongue. Okay. Now, to see the branches of the mandibular and to see the maxillary nerve and arteries before they get through the maxillary foramen there, okay, you need to remove the mandible. This will reveal this shiny structure here. This is the Thyrodius muscle. And the nerve that you see here, 1, 2, 3, these are the branches of the mandibular nerve. Over here, you see the maxillary artery and the maxillary nerve. Okay. Now, this nerve you see here, this is the Bokeh Nerve. Okay. And this one here, the first one, or the most ventral one, this is the mylohyoid. It goes to the mylohyoid muscle. This one here, this is the inferior alveolar. That you can see it go to the medial side of the mandible to go through the mandibular foramen. And the most craniodorsal one, this is the lingual that go to the tongue. So we have lingual, we have inferior alveolar, and we have mylohyoid, and over here we have buccal branch. This one here that is going through the maxillary foramen, this is the maxillary artery, and this is the maxillary nerve. Okay, the artery that runs with the buccal nerve here, this is the buccal artery as well. Lastly, this is a transverse section at the caudal part of the nasal cavity. This is the ethmoidal concha. This is the eyes, as you can see. Okay, this is the tongue here. This is the mandible. These are the molars of the lower jaw, and those are the molars of the upper jaw. This is the hard palate. This is the tongue. Now, the space that you see here between the cheek and the dental arches, this is the vestibule, okay, on the left side, and this is the vestibule on the right side. Now, the space between the tongue and the hard palate and in between the dental arches, this is the oral cavity proper. So this is the oral cavity proper. This is the vestibule on the left and on the right. These are the molars of the upper jaw, and those are the molars of the mandible or the lower jaw. This is here is the ethmoidal concha as the caudal part of the nasal cavity.